Welcome back to We Are Austin, friends. So the school year is coming to a close, which means it's time for summer sports and a lot of activities. Dr. Jarrod Dale from Austin Radiological Association is here to teach us how he spots athletic injuries and the steps you should take to recovery. Hi, how are you doing this morning?
I'm doing well.
Thanks for joining us. We appreciate it. You know, so summertime means kids are out of school. They're staying active. Maybe they're going to dance class more. They're out on the tennis court. They're just playing a casual game of baseball in the field. That can lead to some injuries. What are some of the injuries that you're seeing?
Once the school season is over, people start getting outside more, and it's cycling injuries, it's endurance sports injuries, it's water sports injuries, so wakeboarding injuries are also quite common as well.
Oh, that's a good point. I wouldn't have thought of that, yeah.
We see all kinds of injuries. Primarily, it's small joints and the joints that are more mobile. So hip joints and knee joints are fairly stable, whereas wrists and ankles and fingers get injured probably the most commonly.
I see. So we're not talking as much about broken bones as we might in some seasons where you've got some rough and tumble sports. These are more soft tissue injuries.
Right, and that's quite common for the summer. Once football season starts up again, we start to see sort of more higher grade, more high impact injuries.
And we're going to take a look at some of those examples, but I want to talk a little bit about what is musculoskeletal radiology and radiologists, and what is it that you guys do, and what is your role in caring for patients at the injury stage?
Sure. So at ARA, we are a subspecialized group. One of the groups that we have is a musculoskeletal section, and our role is to be the expert in imaging bones and joints and muscles and tendons and ligaments, and primarily that's sports injuries or overuse injuries along the spectrum of even degenerative type injuries or inflammatory arthritises and even tumors of those specific tissues.
Excellent. So discovering these issues is really step one to getting better. We've got a few examples up here. What are we looking at here?
So this is an image of the wrist, a blown up image as if you were looking at the wrist from this view. Okay. And this was a tennis player who tripped while she was playing tennis, and she had wrist pain, and she came in, and the initial step for evaluating wrist pain is x-rays. And you can see that there's a crack in one of her bones in her wrist. It's called the scaphoid bone. Oh, wow. This is non-displaced. It isn't moved too much. This should heal up really nicely. But 2 months later, she came back, and she was still having significant wrist pain. So we took more images of her wrist, and you can see that the fracture is healed. That's great, but she's still having pain. Oh. And so at that point, it's time to change the imaging modality and try something else. And so if we look at the next image, you can see the image on the left is a radiograph, the same thing, an x-ray of the wrist as if we were looking at it from the side. Okay. And you can't see anything. It looks okay. Everything is where it should be. Got it, right? We then decided to obtain a higher or more advanced imaging, and this is a CT scan of the wrist. And you can consider a CT as a 3D x-ray, where you can remove all the other structure. And using CT, you can see that she's got a fracture through the base of one of her other bones in her wrist that didn't heal appropriately, and that's almost certainly why she was having pain. Awesome, and I want to make sure we get to everything we have to see here. We've got one more, another to look at here. These are images of the elbow in baseball players, and it's demonstrating the power of our sort of high-resolution MRI, where you can see normal ligaments that hold your two bones together. It's this black line. This is a ligament that is strained, so it's stressed, but it has not yet torn, and there's some fluid and white signal around it, as well as a muscle tear along the medial side of the elbow, and then all the way along the spectrum of a completely torn ligament that's pulled off the bone, and this would be one that would be requiring sort of a surgical intervention. This is fascinating, and you know, it's an example of the expertise that we see at ARA. You have to really get in and see these. We don't have a whole lot of time. Can we go through this one really quickly? Sure. This was a dancer. She had finger pain. We came in and did an ultrasound originally. You could see on the image to the left, this is an ultrasound. It doesn't see bone very well, but the lesion was in the bone. Using sort of fast forwarding, we can do radiographs which show that she's got a tumor in her finger. Oh, man. It's not a fracture or an injury, it's really a tumor. And then using the MRI, we can further characterize that tumor. This is a benign tumor, it's not a cancer. It shouldn't cause her any long-term trouble, and we just kind of leave it alone. So she doesn't have to have a surgery or any type of chemotherapy to treat this at all. That is amazing. The technology is awesome. I want to know how we can tell our viewers to get more information about ARA if this is a visit or an appointment they need to make. Sure. ARA physicians are always available. Typically, the way that you would come and see one of our experts would be to go and see your practicing doctor. Okay. They would then perform an exam, and if imaging was needed, we would you'd come and see us, and your doctor would help facilitate that. But
Excellent.
we've got many centers all around the Central Texas area. That
And you can always go to the website, ausrad.com. Is that correct?
That's correct. OSRAD.
Excellent. We really appreciate you joining us this morning. That is fascinating stuff.
No
We're
problem.
glad you're out there helping people get well. Thank you very much for joining us. Thanks.